Have you been told that you have a cyst on your ovary, you're having pelvic pain, and then you're just told to follow up with a gynecologist or your obstetrician for follow-up? I bet this was scary for you because cysts have such a negative connotation associated with them. Well, I'm here to kind of take that stress off of you and explain to you a little bit about what cysts are and what they mean to you. But first, I'm Shannon. I'm a certified nurse midwife, and I've been caring for women my entire career. Without further ado, let's get going. What is an ovarian cyst? An ovarian cyst is a fluid-filled or solid-filled cyst that can develop on the ovary or in the ovary. There are different types of ovarian cysts. One type of cyst is a functional cyst, and the functional cysts happen during the different phases of the menstrual cycle. One is a follicular cyst, and that is a cyst that will actually release the egg in order for you to get pregnant. This is normal, goes away once that egg is released, gone. Then there is a corpus luteal cyst, which is a cyst that secretes hormones and helps, once a pregnancy happens, to feed that pregnancy and keep that pregnancy going until the placenta can kick in and take over that function. Then that cyst will go away on its own. Another kind of cyst that you may have heard about could be a dermoid cyst, or also known as a teratoma. This is a cyst that develops because of reproductive cells that develop in the ovary, collect, and can contain tissue, teeth, hair. These usually will kind of hang around, but very rarely are they ever cancerous. You're going to develop a plan with your provider just to make sure that you keep an eye on that. Another type of cyst is a cystadenoma. And what this is a cyst that develops from the cells on the surface of the ovary. Usually these cysts will contain water or mucus, and they can get pretty large. Another kind of cyst is going to be an endometrioma. And what this is it's a cyst that develops on or in the ovary that contains endometrial tissue similar to endometriosis and can cause pain. These women typically will have lots of pain, and depending on the size and what the management plan would be. What are some symptoms of these ovarian cysts? So bloating, pelvic fullness, pelvic pain if the cyst gets large enough, or if the cyst actually pops. And the reason it popping causes pain is not from the cyst actually popping, but from the fluid that's inside the cyst that is released into the abdomen, and it causes pain because the different pHs of the fluid from inside the abdomen to what actually comes out of the cyst in the ovary. Now, diagnosis of these cysts is going to be made based on ultrasound and pelvic exam. Usually the pelvic exam is going to come first, and if there's pain and tenderness, then an ultrasound will follow. If we have a positive pregnancy test and see a corpus luteal cyst, we know that's what we should see. Also, too, depending on where you're at in your cycle, we may see that follicular cyst that is in the process of going away after it's already released the egg. Depending on the size of the cyst, surgery may also be a treatment option, because if the cyst gets large enough, it can cause problems. Also, if the cyst looks solid, you can have tumor markers done, which is some blood testing just to see if cancer levels are elevated. And then depending on what those results are, will be what the further, treatment or follow-up management will be. What are the treatment options for these cysts? Most of the time, no treatment is needed. The cyst will come, the cyst will go. As long as you're not having any issues, then just following up with the GYN just to have a repeat ultrasound in 6 to 8 weeks or even 12 weeks to make sure that the cyst is gone. Now, if you start having pain, you can do birth control to help manage recurrent cysts. And you can, if they get large enough, have to have them surgically removed so that they don't cause the ovary to twist, because then that presents as an emergency to try to save that ovary if possible. So when should you worry with these ovarian cysts? If you all of a sudden start having sharp stabbing pain on one side, you might need to get checked out. If you start to experience symptoms that would be similar related to shock, so bleeding, all of a sudden out of nowhere, clammy, diaphoretic, or just lots of profuse sweating, fever, nausea, vomiting associated with the pain, any of those symptoms, you need to get checked ASAP so that you can make sure that everything is okay and to see if you need further treatment. I hope this information's been helpful with kind of relieving a little bit of anxiety depending on what you've heard or what you haven't heard. If you have any questions, concerns, or comments, drop them in the comment below. Let's get in the habit of sharing accurate information so that women aren't terrified of what it may be very normal for their bodies to do. I hope you guys have a great day, and I hope you like and follow and share. Thanks. See you soon.